The ProACT Know-How, brought to you by ProACT.
Hi, this is ProACT Sam and welcome to this week's Living and Working Abroad presentation, where we're looking in this webinar at the details of the new Cyprus health insurance tax for the universal health system that's been brought in. So we're going to look at what, who, how much, how and when people have to pay. Now, we're not talking about the contributions you have to pay at the point of service. That could be like €1 for a prescription or €10 to see a consultant. It's a free service for point of treatment with your GPs each year or for any other treatment. But it is a universal health service that's available. And there is a tax that goes alongside it, which is to create the fund to pay for the health service. This is what we're looking at today. We've got a book that you can download at our website at proactpartnership.com, and you can follow us on our Living and Working Abroad page on Facebook and get into discussions on this. The one thing about the detailed information that we know is that it's still a work in progress. The implementation of the new Cyprus health system is in effect from 2019. People start paying from the 1st of March, and the service becomes available on the 1st of June at the end of May 2019, but it's not fully implemented until June 2020. And there's many things, many snags along the way, many situations need to be faced and decisions need to be made. And what we're looking at here is just the tax and the cost implication for expats, the expat family and expat business living and working in Cyprus. So if you're considering coming to Cyprus or you're living in Cyprus, what is your qualification and how is it going to affect you? Some of these things might change in the future. Some of these things might be impacted by Brexit, but this is what the situation is today. So first of all, let's look at what the new tax towards the health service is for. So it's chargeable to anybody who is a tax resident in Cyprus. So if you are a Cyprus resident, you have a yellow slip as an expat, and you're a tax resident, or even if you're a tax resident in Cyprus and you're living and working abroad, your tax resident is in Cyprus, then it's taxed on earnings as an employer or as an employee. It's taxed on pension income, anything that is defined as a pension. It's taxed on other income, including dividends, bank interest, rental income, and any other payment. So if you get a payment from the Cyprus state treasury for any reason, that payment, whether it be, it becomes a taxable payment. Also, a benefit in kind. So if as an employer, you're paying an employee, you're receiving payments into a medical fund, a pension fund, a provident fund of any type under Cyprus work, then those payments are taxable under this new national health insurance tax as well. So who's paying it? Well, obviously we've talked already about anybody who's paying social insurance as an employee or an employer or self-employed is going to be paying this tax. So if you're working for an employee as an employee, your employer may have approached you or shouldn't do. If you're an employer, then you should talk to your staff to see who's going to pay this, as we'll see later on how the payments are made. If you're receiving a pension, then tax is due on that. And obviously, from a Cyprus perspective, that can be deducted at source. But it's due on all pension income. This is what the law states at the moment. It refers specifically for the health insurance tax to the Cyprus income tax law, which defines pension income as pension income, defines the people that are entitled to pay it as anybody who's a tax resident, any individual. Anybody who's a municipal employee or official getting income, it is taxable on that income, whether it's a local government or a state worker. All those incomes are payable. Any type of income that you have, any type of income earned, is taxable. Now, if you're an expat that's based in Cyprus and you're living and working abroad as a contractor, then that income can be taxed abroad, but for your bank purposes, for your investment purposes, to avoid taxes in your home country as an expat, then you might want to be a tax resident in Cyprus, and traditionally that non-remitted income is not declarable on your tax return, and therefore it's not taxable. If it is declarable on the tax return, then that income is taxable for this new national health insurance tax. Any payments from the Cyprus State Fund, so if you're entitled to a Cyprus state pension or any other payment from a government in Cyprus, then that will be deducted at source, and is being deducted at source from the 1st of March 2019 as a tax, the National Insurance Health Tax. So how much does it cost? In our guide that I've mentioned already, which you can download from our website at proactpartnership.com, we detail all the different rates and scales, and there's a starting rate in 2019 and it goes up in 2020. But in broad terms, for this webinar presentation, the rate is 1.7% generally, rising to 2.65% next year. So there's a slight variations for employees, employers, and government officials or pensioners. The one big variation from those rates is for self-employed people who are deemed to be a bit of an employer and a bit of an employee, and they're already and they pay a rate this year of 2.55% and next year 4%, which is being charged on social insurance contributions from the 1st of March. So that's generally how much it's going to cost. So how do you pay the tax? If you're an employer, it's your responsibility to pay that with your social insurance contribution. If a bank is paying, or a local government is paying that type of income, then again the tax is withheld at that source. If you're a property agent, and you should be considering collecting the tax as well on the rental income you're paying out to a client. If you're paying social insurance as a self-employed person or as an employer, then you pay the health insurance tax with those social insurance contributions. If it doesn't collect it through that method in your income tax return and your income tax assessment, the tax is collected then. And as I've said previously, any payments that are made by the Cypriot government, the Cypriot Treasury, will be deducted at source. So if you come to Cyprus as an expat and work sufficiently to qualify for Cyprus pension, that the national health tax will be deducted at source. If you pay, if there's no way that a withholding tax can be taken or payment can't be made with social, then the tax can be paid under the temporary tax rules in Cyprus, or as a pay-as-you-earn, or under self-assessment. And so self-assessment is paid in twice a year, from June and in December, and the national health insurance is paid at that time based upon your income tax liability. So it's very, very clear what the law is that you either have it deducted at source by your employer, or the payment provider, the pension payer, or the tax is paid with your temporary tax return, or with your self-assessment, a separate self-assessment. The point being here is when is this tax paid? The tax is paid from the 1st of March, and every individual is obligated to pay it. Everybody who is paying tax through any one of these different methods, they're paying as an employer social insurance, or they're deducting pay-as-you-earn tax, or they're paying out a rental income. Any people that or organisations like the State Treasury that are paying out or receiving income is obligated to declare and pay that income. So that's the obligation of an individual for themselves, the employer to deduct and pay it on behalf of the employees, the employer's contribution. The employer's not necessarily obligated to, it's a mixed thing. The individual is responsible for their own payment of the tax, but when they're receiving a salary, the individual as an employee, the employer must deduct that pay. But that employee, if they've got other income, rental income for example, dividend income, bank interest, they are responsible for declaring and paying that. So an employee could now be brought into a temporary tax assessment or a self-assessment to declare dividends or bank interest or investment or rentals arising outside Cyprus, but which are declarable as they are Cyprus tax residents, given that the income tax law in Cyprus says if you're a tax resident, you pay tax on your worldwide income. And the penalty for that, the obligation is the company, is the employer, is the individual, but late payment penalties apply. So as if with all the other taxes, this is not income tax, it's not a defence contribution tax. This is a separate and a new tax, but the same penalty regime, interest regime apply for late payments of these taxes. So it's full and real and in your face, and those taxes are due from the 1st of March. The rules and the laws as it states does provide that there might be some changes in the future, but there are still some contradictions. So the biggest contradiction that we're pressing to get an answer for in the moment is with an S1. If you've got an S1 from your home EU country as a retired expat, then you've got entitlement to the free health care system, free GP service, free treatment, and you could be exempt from the contributions for the prescriptions at £1 or £10 for a consultant appointment. But there is nothing in law at the moment specifically that says that you're exempt from paying the national health insurance tax. And until there is a change or an agreement made by the government, retired expats with an S1 still have to pay the national health insurance tax. Now, Brexit has a factor on that. If the UK leaves the EU, then the S1 is issued under the EU health and social insurance arrangements. Now, those agreements don't apply if the UK leave the EU without Brexit. Now, the UK could leave with the withdrawal treaty, which gives a transition period, or with no deal, with no transition period. The withdrawal treaty with the transition period means there's a status quo. So even if the UK leave, the transition period means that to the end of 2020, the S1 will still apply. So whatever rules are changed or enacted for an S1, they would apply through the whole transition period. Having said that, Cyprus had a bilateral social insurance agreement with the UK before the EU in 2004, so it may well be that another arrangement is put in place, but the UK would have to fund the cost, the taxation that Cyprus would otherwise be giving up to pay for free healthcare for UK pensioners. Now they may do that, but the UK's position, the clarity of the UK position again depends upon what type of Brexit they had. Now up until the day before Theresa May resigned, she still thought she might get a withdrawal treaty through, and it may be that that withdrawal treaty still does go through, in which case the rights of EU expats will remain the same. And I need to go and see a doctor, and the S1s will still be in force at least until the end of 2020. And you know, like between the UK and Ireland, a new long-term trade agreement and arrangements were confirmed between the two countries in April. Not a full bilateral trade treaty, but an agreement so that they can carry on as before. So you know, as we go into new era of Brexit thinking, you know, no deal is not such a bad deal, given that you look at countries like the USA that trades and has agreements. It has no bilateral treaty with the EU, and yet America still trades with the EU, so the UK could do the same as that. The USA also trades with China and Japan on the same basis. So it'd be interesting to see how things evolve. The key issue that we're looking at is how the UK government's decision on how they will treat British expats under this new rules will be considered. So it is being addressed at a national level by the Cypriots, and they will no doubt be making representations to the UK. The UK generally don't want there to be a cost for the healthcare, but this is not an income tax, and it's not a payment to for the treatment. This is a new tax that Cyprus introduced, and the UK would have to make arrangements to subsidise the cost to the Cypriots. The Cypriots need to offer a concession to expats to be exempt from paying this additional new tax. So everything's in play at the moment. We're trying to get clarification of that, but as it stands at the moment, any earnings, any pensions, any income, and any payments and benefits in kind are subject to this new national insurance tax on employees, self-employed, employers, and any agency that's paying money out. The cost starts at 1.7, is rising up to 2.5%, 4% for self-employed people, and it's paid either by withholding tax, by a temporary tax or self-assessment in Cyprus, through online tax returns and online payments from the 1st of March. And if you need any help, you can get more information at our website at ProACTPartnership.com and download our guide to healthcare, or you can also give us a call, contact us at our website ProACTPartnership.com, or our team at Living and Working Abroad on Facebook, and we can answer your questions and help guide you on what is best for your family and for your business living and working abroad in the EU, and how you can support your team, your business, your family, and what the tax implication is going to be for your property, business, pensions and earnings living and working abroad in Cyprus. Thanks very much for listening, and we'll see you again next time.
The ProACT Know-How, brought to you by ProACT.